Oh, it didn't do the hello everyone. Uh Welcome to our latest stream. Today we're going to be talking about suicide prevention awareness, and that is the month of September. And joining us today is Nikole Jones, who is one of our suicide prevention coordinators, and she is going to give us the skinny about what's happening throughout the VA Maryland healthcare system in the month of September, and she's going to let us know why it's so important. Welcome, Nikole. Thank you for joining us.
Thank you for having me. I'm excited to be here and share this good news. But as you know, and as you mentioned, Suicide Prevention Month is in September. And our suicide prevention team has been working diligently to schedule and host several wonderful events to, number one, get out awareness about suicide prevention, also provide resources for our veterans, our veteran family members and friends, and also our community partners who serve veterans in the community.
Well, that's a really wonderful thing. And I see you sent in a flyer about a walk. Would you like to talk about the walk that we are doing, and why it's important?
So we are hosting our third annual Suicide Prevention Walk on September 10th, um, next month. And it is actually World Suicide Prevention Day. And what's exciting about the walk is it's about a mile around the campus of Perry Point, our Perry Point VA Medical Center. It's a wonderful opportunity for us to connect with our veterans. The walk is to bring awareness to suicide prevention. Also, we have a health fair that we do in our gymnasium the same time. So once the participants walk through the campus, they can then go into our gymnasium and meet with other programs, resources, community agencies that offer support for veterans, and they can get resources. We give out swag. We even have a scavenger hunt. People love the scavenger hunt, where they meet all the tables, and at the end they get a challenge coin. And so we're just really, really excited. A couple of things about the walk that I'm excited about is we have some stops along the way of the 1 mile walk where we're making hope boxes at one. We're actually at a second table where paying homage to those that may have died by suicide, called a remembrance table. And then our last stop, we're making a rock, painting rocks. Someone can paint one to leave for someone who's struggling to have as a source of strength, or they can paint one for themselves and take it home with them. So it's just a whole lot of great activities. We encourage people to bring a friend. Last year, we had about 400 participants, and you can get a free t-shirt that actually was designed by someone who participated in our walk last year and submitted a form through our arts. It's an arts committee. And we select a winner each year, and they design the t-shirt for the next year. So even someone who comes this year may be able to design our t-shirt for next year.
That sounds wonderful. So, am I correct? Is that anyone in the community who wants to support veterans or support suicide prevention can participate?
Absolutely. We want to encourage our community partners, our community residents, someone who may care about a veteran, have veteran family members. Anyone is able to come. The main idea is we want to get out the word about suicide prevention, share resources about what to look for and what resources are available in a crisis, and just really provide support for those that may be struggling.
So, I do have a question. We have the 988 line. Can you talk about how the 988 line, when someone is in crisis, talk about first what a crisis looks like, and then what happens when they actually call that number? How do they get in touch with us if they are Maryland, veterans who live in Maryland?
So our Veterans Crisis Line, it works like this. You can dial 988 if you're a veteran and you want to connect to our Veterans Crisis Line. Once you press 988, you then press 1. That will actually take you to our Veterans Crisis Line. And they're a VA skilled professional licensed clinician will open the line and talk with you about what's going on. You can call if you're in crisis, or if you're suicidal, we hope that you call and get some help immediately. But even if you're not suicidal and that crisis is just building, we want you to call so you can get support to avoid being suicidal. And then what happens is they screen and address the risk, and then they refer you to our local VA. And so basically, they will then connect you with the VA closest to you. And then that VA suicide prevention team will reach out to you to really get you connected locally. For instance, if you're in our catchment area, Maryland, you call the Veterans Crisis Line. We will follow up with you to see if you need an appointment, if if you need meds, or if you haven't been enrolled, we'll help you get enrolled. And so the idea is to really connect our veterans who are at risk or having a difficult time, connect them with their local VA and resources they may need to help them get back on track.
That's great. Since we're raising awareness for suicide prevention, can you tell people what are some of the subtle signs that someone might be thinking about suicide, and what are the myths? Many people have said that they don't want to ask anyone if they are contemplating suicide because they're afraid it would cause them to commit suicide. So can you talk about that a little bit? Like, alert our viewers about what some of the signs are. What are some things that people say that might indicate they're thinking that?
Yeah, well, I'll start with the myths. The myth is sometimes people believe that if you ask someone if they're thinking about suicide, you're planting that idea in their head. And that's just absolutely not true. And so we want to make sure that people know it's okay to ask. And actually, for the person that's struggling, it is a relief that someone recognizes what they're going through and ask them that question, because it offers the support that they're looking for. They really just want help. Most people who are suicidal don't want to die. They just don't want to live the way that they're feeling. I would say for family members, friends, and anyone that's concerned about someone that may be struggling, you want to look for some subtle signs. Most of the time they're subtle. They may be having a hard time sleeping. They may be losing their appetite. They may isolate themselves from family and friends, not do things that they used to love and enjoy. And then maybe they may be making statements about, feeling hopeless. Like, I just, I can't live like this, or I just want to give up. Those statements really can indicate that someone is thinking about suicide. And it'd be important to really ask that question at that point.
That's so wonderful for people to know, because I never would have considered that someone who was having a hard time sleeping might be considering suicide. That's a very subtle, because it's very easy to overlook someone who's having trouble sleeping. It could be just insomnia or whatever. So that's a very important thing. And what are some other things that are going on around suicide prevention throughout the VA Maryland healthcare system? I know you talked about a day of remembrance or some other things. So can you alert our viewers about what else is going on that they can participate in?
Sure. First of all, let me go back and say I want to talk about one other important issue when it comes to suicide prevention is being aware of the lethal means in your home is absolutely important, especially firearms, because they are the most fatal and most dangerous lethal means that we have. And most suicides are with a firearm or a long rifle. So taking inventory when someone in your home is at risk is so important. We do offer free gun locks. That's something that will be given out at our third annual walk at Perry Point. And we want to make sure that people know that saving lives starts with keeping your environment safe and locking up any firearms that you do have in the home. With that said, we, in addition to our walk, we also are going to be offering a training at the Baltimore VA on September 29th, and it starts at 11 a.m. to 12:30. It's called the Friends and Family VA Save. And that is actually going to be a open training, free for anyone that's interested. We encourage veteran family members and friends of veterans, or even veterans themselves who may be concerned about a battle buddy. Come in, meet with our suicide prevention team. We're going to talk about the risk for suicide. We're going to talk about what things you can do when someone you know is struggling. We're going to talk about the resources that are available, like the Veterans Crisis Line, and give out free gun locks and other materials like magnets that can go on the refrigerator. We can talk about suicide safety plans and hand out blank forms for family members to go home and really talk with their loved one about the risk for suicide and how to create a plan of action that will be helpful in keeping someone safe.
So do people have to register, or do veterans and their families have to register for Friends and Family VA Save, or how can they get access to this event?
We encourage people to register so we'll know how many folks are available. And you can register I'll give my email. That's a great way to just let us know we are interested in coming. We just want to get a count of how many people are planning to attend. And my email is Nikole, Nikole .jones@va.gov. And so we want people to let us know that they're planning to come, but the door is open for anyone to show up on the day of as well. We really just want this to be a resource, because what we find is that our veteran families and friends and other supports, they recognize the risk for suicide and self-harm, but they might not be connected with the VA. They may not know that that loved one is really at risk because they've never had a training. They've never been exposed to suicide. And so our goal is to make sure that if they're concerned, if they're curious about, okay, I'm worried about them because they have all of these other things going on, let me make sure I'm armed with some of this material and knowledge so that I can make a difference in their life. And so, yeah, if you're listening now and you know a veteran and you know a family member that's struggling, share this information with them so that they also can come in and engage in this presentation that we're offering to give them support.
So do we ever hear any kind of stories of success where veterans will talk about how the help they received really impacted them and changed their lives?
We hear it all the time. And my team and myself, we hear it when we talk to the veterans that we're working with, that, they always say, you guys really saved my life. And it's humbling. But, really, this resource is available for someone's when they're in immediate crisis. We've had veterans who are on the verge, and I mean pills in hand, firearms loaded, who have called the Veterans Crisis Line and actually been able to get to a local hospital and have, with the support, turn things around. And it's very humbling to know that we can be there for someone in that moment. The other part of that is we just want to make sure the resource is out there, though, so that people do know that in those moments, even to the second, if they're thinking about suicide, that it's never too late to pick up that phone, dial those 3 digits, 988, to get the support. And if it's really emergent, 911, so that someone can come and make an intervention with them.
So tell me what family members can do if they feel someone is perhaps, after they have the conversation about, are you thinking about it? And let's say someone is resistant to care. What can family members do to help bring that veteran in for help, because sometimes it's really hard to accept help. Like, you need help, but it's hard to accept it. And it's hard to say, oh, I'm going to be that person, who needs to reach out for help. So can you talk about what it means to actually reach out, the strength it takes to reach out, and what family members can do to help their beloved veteran?
Yeah, it does take courage, and we provide support and encouragement for any veteran, because it is hard. In the military, you're taught to pull up your boots, pull yourself up by your bootstraps, and those kind of things. When in active duty, they're important because it may be important for the mission, but we try to encourage them to know that once they're out of the military, it's important, and even in the military, it's important to take care of yourself too. That you have to be able to know when you need supports, and there's no judgment. There's no judgment here. If we would not judge someone for having cancer, so why do we judge someone for having suicidal thoughts or mental health issues or substance abuse issues? It's important that family members don't engage in stigma, mental health stigma, and philosophies that state that, we're strong, we can will mental health and substance abuse away if we're strong enough. No, that's not how it works. And so it's important that we have compassion, but also meet the moment. If they're saying that they're not feeling safe, take them for their word. If they're saying they're suicidal, it's not for attention. They're really struggling and want some help. And I would say the first thing that they can do is they can also call the Veterans Crisis Line. Family members and friends of a veteran can call and get information. They don't even have to disclose the veteran's name or information. They can just call and say, hey, I'd like to talk with someone. I have someone in my family that I'm worried about, and get some resources that they can utilize to support that veteran. But they can even escort them to a local emergency room. The idea is to be there for that individual. Let them know that help is available, and connect them with someone who can help them.
That's wonderful. So, and for those people, do we have a day of remembrance? I vaguely recall that you said we were having a day of remembrance.
We
Can you
are
talk
having
a
a
little
day.
bit about that?
Yes, we're having a day of remembrance, which is going to be an opportunity. And we do this. This is actually our seventh day of remembrance. And we've been doing it for 7 years at Perry Point. And it's grown to be a really meaningful experience for those that participate. Because basically what we do is we talk about how veterans can, and I don't have the flyer for that one. I can make sure that we try to
We
pull
can
it
put it in
together.
the comments afterwards.
Okay. And so it's a ceremony that we do in collaboration with our chaplain service. And it's at our Perry Point Chapel, and it's going to be held on September 19th. And it starts at 11 o'clock, and it's to 12 o'clock. And basically, it's just a moment where we talk about the importance of suicide prevention. And then we really talk about those that unfortunately died by suicide, and really honor that their life, their struggle, and just, in the moment, support those family members who have lost someone. About 4 or 5 years ago, we planted a tree called the Tree of Life outside of our chapel. And over the years, we've watched that tree grow. And each year we do some kind of activity around our Tree of Life. I think this year we'll have flags around the tree, and we'll be putting little leaves with messages, and some folks may leave the names of their loved ones that died by suicide on the tree. And it's just a way to really remember them, not just for how they died, but how they lived and their life as a whole. And so we invite anyone is welcome to come to that. Again, it's on September 19th at 11 to 12 noon, and it's at our chapel at Perry Point. So we really, really invite people to come out and participate in that as well. Our tree, our remembrance table at the walk will actually be doing some of those leaves that we'll use. And so even if you're not able to come to the chapel for the ceremony, a leaf that you may create at the walk would be at the ceremony, and we'll use that to put on our tree of life outside the chapel. So it's just a beautiful moment where those who lost someone can feel supported and connected with their loved one who had passed on.
All right, so we have a number of things going on in September for suicide prevention awareness. I want to thank the people who have sent us likes. Thank you. I see them. Also, if you have any questions, feel free to post them in wherever you're watching. We will monitor those and make sure we get you some answers for you if you have any questions. Nikole, is there anything in particular that you want anyone who watches this video to know about suicide prevention and what VA does to help veterans overcome this mental health issue?
Just know that you are not by yourself, that we're here for you. There are resources that are available, and that joy comes in the morning. Like, this is a temporary, whatever you're going through, it's temporary. And that with help, with support, with your loved ones' encouragement, you can make it through. And that your life will get better. And just reach out to us. Reach out to us through the Veterans Crisis Line. You can even call your local VA and ask for your suicide prevention team and speak with them to get support or get some kind of help that you may need, or resources that might help things come together for you. We are here for you. You're not alone.
Very important messages. Thank you, Nikole, for joining us today. Thank you, everyone who watched from wherever you watched. Please join us as we raise awareness for suicide prevention during September. But we also want you to know that even though we're raising awareness in September, the VA in Maryland, the VA Maryland healthcare system, has many people like Nikole, who is a suicide prevention coordinator and who will work through the year to help you reach the services that you need to be on a better and a better journey, a better wellness journey. Mm-hmm. So thank you, everyone. And with that, we say ciao. Thank you for the likes. We appreciate that. And goodbye for now until our next stream. We have a next stream on the 4th of September, and that is with peer support specialist Jonathan Hollins, who is going to be talking about lethal means and how to remove lethal means from the lives of our beloved veterans. So thank you so much for joining.